I'm Jessica, speech language pathologist and owner of Kentucky Therapy Solutions. I know how busy you are, and finding time for one more meeting in your day can be a real challenge. So I created this video as a way for you to get to know me, learn more about our practice without needing to schedule that precious bit of breathing room you have in your day. Now, to grab your attention, I have a few reviews I want to read you from our valued clients. Mallory completely changed our lives. She provided amazing services to our son to help him advance in his speech. After just 4 to 6 weeks, our son is back on track for his age. I was blown away by Taylor's professionalism, practical tips to try between sessions, and expert knowledge. We quickly saw improvements and felt confident our daughter was finally getting the nutrition she needed. Jess is incredibly knowledgeable, personable, kind, and patient-centric. She's the best. I was so impressed with how well Anne interacted with him, how she prompted him to speak through play, and how she reassured me his development was on track. Do I have your attention yet? At Kentucky Therapy Solutions, we're committed to making a difference for our children and their families by providing a variety of therapies under one roof. We have speech, language, feeding therapy, myofunctional therapy, lactation consultation, counseling and social work, and physical therapy. We offer comprehensive support that allows families to avoid the hassle of really running around all over town to access these vital services. One of the best parts of our clinic is that we're really here for the whole family. We support moms, children, and we really recognize the needs of a holistic approach to treatment. This is why we're thrilled to welcome our 2 new providers, Rachel Potts, she is an international board certified lactation consultant, and Taylor Shelton, our doctor of physical therapy. Both have immediate availability to help you and your patient's needs right away. Again, immediate availability for many of these services. While we're addressing all these therapies, I'd like to cover just the top reasons that providers really refer to us right now. Number 1, speech therapy. So this is kind of your typical speech umbrella. Articulation, language, social communication disorders, expressive and receptive language. Those kids that are not really meeting their milestones or maybe are not understood. Under the feeding therapy umbrella, we address picky eating, food aversion, oral motor skills deficits, failure to thrive, kids who are struggling with that kind of like transition to solid foods, and then sensory processing challenges with food. So those kids that really have those sensitivities that cause really strong reactions to texture, smells, tastes, you get the picture. Within our myofunctional therapy realm, this is one that I find that people don't know as much about. So what we address and what we treat for that is we want the tongue in the correct position for breathing, speaking, feeding, sleeping, swallowing, you name it. So we really address the tongue thrust. We address thumb or finger sucking habits, mouth breathing, improper swallow patterns, and dental malocclusions. So any orthodontic issues like open bite that myofunctional therapy can help address. The name of the game is getting the tongue in the correct position. So within lactation consultation, we actually address that really early on in infant feeding, but some other reasons that people refer to us for lactation concerns or really infant feeding are breastfeeding difficulties. So mom is complaining about her latch. She's complaining about pain, positioning, maybe not transferring enough. So those babies that are not gaining enough weight. We address low milk supply, infant tongue or lip ties, maternal pain or discomfort during feeding, and then any really concerns with infant growth or weight gain. Within physical therapy, our physical therapist is really specialized across the lifespan. She has done a lot of training and a lot of additional coursework in order to treat from infancy all the way through actually adulthood, but primarily sees pediatrics. She addresses gross motor delays like in crawling, walking, running, or balance skills, torticollis or plagiocephaly, coordination issues, so age-appropriate activities like jumping, climbing, running, post-surgical rehabilitation, so recovery following the surgery or procedure, and neuromuscular conditions like cerebral palsy that impact muscle tone, movement, and physical development. Counseling is our newest service, and we're so excited to launch this in January. So again, that means that we have immediate openings. We can get your families, your clients in right away and get them the help they need while taking insurance, but I'll get to that a little bit later. What our counselor specializes in is pre and postpartum mental health, so support for those mothers dealing with anxiety, depression, either before baby arrives or once baby is already here. We address behavioral issues in children, so those that are struggling with behavioral regulation, aggression, attention issues, parenting support and education, so we don't actually just see the kids, we offer family support and can help all of the things because we know that it's really not just the child. Everybody is involved when it comes to some of these counseling issues. We also treat trauma or anxiety in children and adolescents, and then family transition. So when new siblings, divorce, moves are happening, our counselor is very skilled in treating that. And again, that is launching in January, but go ahead, you can refer now because we are getting her scheduled. At KTS, we've also partnered with Kentucky Integrative Autism Center in order to seamlessly provide assessments for those seeking an assessment on or seeking a diagnosis on the autism spectrum disorder. We will have openings again starting in January for this service. So our counselor is going to streamline the beginning part of that, and then we will refer on for the official diagnosis, but at least get the ball rolling for these families that have been sitting on wait lists and are really eager to get some help to find some answers for their child and for their family. We're proud to be in network with multiple insurance companies to better serve your families in our community. We are in network with Anthem, Blue Cross Blue Shield, United Healthcare, Aetna, Humana, and making our services more accessible to families across Kentucky. To further support families, we kind of understand, life is online now, and we wanted to offer something to these families when they're not able to maybe make it in for a one-on-one session, when they're not able to get scheduled and have a recurring one-on-one appointment. So we have two virtual offerings. One is a Mommy and Me milestone support group. This is led by our lactation consultant and our counselor. So they will tag team, they will support moms in a 6-week virtual support group addressing infant feeding, whether that's breast, bottle, milestones that we need to be looking for and meeting. And then in addition, our counselor will come in and they will support mom in that transition into motherhood, making that a joyful time, not a time of stress or anxiety. Additionally, for our families who are working through some mealtime struggles, we've created the Mealtime Makeover membership. This is a monthly offering where families can actually get access to me, our resident feeding therapist. We do have more, but I am so excited to offer families this virtual option to meet with me every week to get videos, audio recordings of actually how to implement some feeding therapy strategies if they're not quite sure that they want to get involved in therapy yet, or they just want to try some things at home before scheduling that assessment. This is a great opportunity for families who are complaining that my kids don't eat enough. They really don't ever eat the meals that are served to them, that our family eats. This is a great opportunity for them to hop on with me, ask me questions, really bring me into their lives in a, I'm going to say like a non-committal way. We can do this online. They can do it on their own schedules. It is an awesome offering that families can come on into our world and be a part of the Kentucky Therapy Solutions family. If you'd like to learn more, or you want to discuss how we can partner with you to support the families you serve, please don't hesitate to reach out. You've got my number from past things that we have passed out, but Jessica at KentuckyTherapySolutions.com is going to be your best way to reach me, Jessica at KentuckyTherapySolutions.com. I would love to be a resource for you, for your families, and I would love to answer any questions you have about our services, about what we offer, where we're located. We are in the Hamburg area of Lexington, but we also serve many schools throughout Lexington, such as Centenary, Sayre School, Park Early Child Care Center. We are all over the community serving these kids in their schools as well. My contact information is also listed below this video, so if you have any questions, please take a look at this email. You've got everything in there. Other than that, please be on the lookout. We are dropping off folders, marketing materials. We are bringing things to you, treats, of course, every month, because we are so excited to be in this community and to really support the families that are here with us too.